Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here for another one of our Monday live Q&A sessions. We're here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, as well as questions that you've submitted over onto our Facebook, Instagram, and Twitter. Remember, you can follow us on Facebook, Instagram, and Twitter for additional content. Please like and subscribe to the channel. Subscribing to the channel is really, really important, and it really helps me out as a content creator. And for any of you guys who don't know, we're now a part of the YouTube Health platform. This is where YouTube has decided to go ahead and verify the content and the creators of health channels to make sure that we are actual healthcare providers and that our content is legitimate. So this is something that you guys can enjoy, knowing the safety that the stuff that you're receiving is accurate. Um, Please remember, share the channel with your friends and family. And for those of you guys who end up staying until the end, I'm going to go ahead and give you a sneak peek at tomorrow's video. So I'm going to go ahead and I'm going to answer or start answering some of the questions that you guys put into onto the videos this week. But if you guys have any questions, please feel free to put them into the chat. So the first question that we got was on bleeding, and I get a lot of bleeding questions. Hi, doctor. I'm 5 weeks pregnant, and I started bleeding this morning. It looked like my period, and it's painful. I'm also concerned about my pregnancy. So this is an extremely common question that we kind of get, this kind of scenario. And so what you guys need to understand is in the first trimester, there's a lot of reasons why a woman might bleed. And it's actually a lot more common than you realize. And it doesn't mean that the pregnancy is going to end in a miscarriage. So you can bleed because of sex, for example. You can bleed because of implantation. When the baby implants into the side of the uterus, you may have some implantation bleeding. There's something called a subchorionic hemorrhage, which I'll get into a little bit later with one of our other questions. And that's a pooling of blood underneath the placenta that can also cause it. You also might have some bleeding from different placental positions. That's the placenta is the organ that feeds the baby, and sometimes it'll be in different positions. So these are all reasons why you might end up having some kind of bleeding. Now, of course, you might also have bleeding because you are having a miscarriage. So this is why it's so essential that you go ahead and you get evaluated by a healthcare provider. Now, most of you guys are either going to call your healthcare provider or you're going to head straight into the emergency room. If you're heading straight into an emergency room, we actually have a video that we published last week. This is the things that you want to see happen in an emergency room. A lot of people aren't sure what to expect when they're going in very early in pregnancy to get evaluated for bleeding. So these are the things that you want to ask that they do and check for to give you a reason why you might be bleeding and help determine your plan of care. Additionally, even if you don't end up going to a hospital, you want to make sure you're calling your healthcare provider because the gold standard is to do an ultrasound. And the ultrasound allows us to image the uterus, right? Make sure the uterus looks good. It allows us to visualize a baby and it allows us to visualize the placenta. These three things are very important in determining your cause of bleeding. So it's very, very important that you go ahead and do that. The final thing I'm going to tell you is if you're having pain with bleeding, this is definitely a big warning sign. This is something not to ignore, especially in the first trimester. One of the leading causes of pain with bleeding and miscarriage can be an ectopic pregnancy. So, an ectopic pregnancy is a life threatening medical emergency. So, this is where the fertilized egg, the baby kind of goes, and instead of coming down, you have the ovaries and then you have fallopian tubes that come into the uterus, right? So, your fallopian tube is here. But the thing is, the baby will end up where the baby ends up implanting into the fallopian tube instead of down in the uterus. So the baby can grow there, but the problem is the baby will cause the fallopian tube to burst, and this can be a life-threatening emergency for mom. So mom can actually hemorrhage due to that. So unfortunately, this is a medical emergency that requires immediate surgical intervention. And if we don't do that, unfortunately, mom might pass away. So it's very, very important that you get evaluated when you are bleeding early in your pregnancy with a lot of pain. So, Hi, Z. Yes. Anybody who's joining us, I'm Dr. Samantha, the maternity mentor. Please feel free to ask any of your questions in the chat. I've gotten started with some of the questions that were on the videos this week. So, since we had that question about bleeding, I'm actually going to jump in to questions that we got that are going to reference some placental positions and that subchorionic hemorrhage. And all of these came on my sex video. So I think it is very important that we talk openly about sex. Sex is a normal part of, being a human being, and this is how we make babies. And so I think this is a very integral part of your care, and it's very misunderstood. There's a lot of taboos around it. So people are often afraid to ask the questions that they need to ask about sex during pregnancy, especially when they're having complications. So we're going to delve into sex. So the first question was, I had a subchorionic hemorrhage at 12 weeks and I was put on pelvic rest, which is now gone. But at my last ultrasound, they told me I had a low-lying placenta, which is probably going to move away from my cervix by the time I reach 32 weeks. I'm 24 weeks now, and I was wondering if anal sex would be safer for me. So this was a great question. It had a lot of moving parts. I think it's a good place to start. So let's start with a subchorionic hemorrhage. So you have your uterus and you have a placenta. And this side of the placenta is a whole bunch of blood vessels and it attaches to uterine wall. This side of the uterine wall becomes a whole bunch of blood vessels and it creates that placental bed. It's an area intermeshed where you have a whole bunch of blood vessels going back and forth. They go to the baby to give nutrients and oxygen, and they come away from the baby to take away the toxins, right? And so that's what's happening under here. Now, when this happens, right, sometimes you'll get this pooling of blood. So imagine a bruise. When you hit yourself, you get that black and blue mark. And what that is a pool of broken blood vessels. So you see that blood seeping out under your skin. That's all a bruise is. That's the same thing that a subchorionic hemorrhage is. It's basically a pooling of blood underneath the placenta. Now, just like the bruise. So your bruise might start out super big, but then over time, it gets smaller and smaller and smaller. Subchorionic hemorrhages can do the exact same thing. They usually will start out being a very large part of the placenta, and then over time, they shrink, okay? And very often they disappear. Part of that's because the hemorrhage gets smaller, and part of that's because the placenta gets bigger. When your baby first starts out, your baby's teeny, teeny, tiny, so that placenta is teeny, teeny, tiny. By the time your baby's born, your placenta can be like very big, so that grows with the baby. So that's what a subchorionic hemorrhage is. Now, depending on the size of the subchorionic hemorrhage, depending on your pregnancy, depending on a lot of factors, your doctor may recommend pelvic rest. So I want to make sure that you guys understand. She said pelvic rest. So what is pelvic rest? Pelvic rest is basically nothing in the pelvis. So nothing in the vagina, usually nothing in the anus. This means no fingers, no toys, no penises, no oral sex. You can't use tampons, no douching, nothing inside the vagina or the anus unless it's been prescribed by your doctor. That is pelvic rest. In addition, pelvic rest usually includes not being able to have an orgasm. And that's a very key thing because with pelvic rest, we're trying to avoid stimulation of the pelvic area. Now, when you have an orgasm, you release the hormone oxytocin. Oxytocin is the natural form of Pitocin. Pitocin is the medication we often give in labor and delivery to induce labor, to start contractions. If you think back now to when you have an orgasm, usually most women will get like a kind of cramping sensation, a good cramping, not a bad cramping, or quivering sensation in the uterus. That's the oxytocin that's interacting with your uterus. Oxytocin is also the milk ejection hormone for anybody who's thinking they've heard of it related to breastfeeding. It's the hormone that says send out milk. And it's also the love hormone. This is the hormone that allows us to bond with babies. That's why when we release the oxytocin for breastfeeding, that encourages the bonding process hormonally. When you're having an orgasm, it encourages the bonding process with your partner. So that's the oxytocin because that is very stimulating to the uterus when you do have an orgasm, and hopefully you are having orgasms when you have sex. that can encourage potentially some preterm contractions. And depending on how large the subchorionic hemorrhage is, well, most of the time they're benign. Occasionally they're big enough that we want to make sure we don't accidentally dislodge the placenta if it's not like basically attached strongly enough. So that could be why. Now, going on. So she was placed on pelvic rest until the subchorionic hemorrhage went away. Again, I told you guys it can go away. Then at her last ultrasound, she was told she had a low-lying placenta. Okay, so placentas. Normally, we got this uterus. This is the cervix going down to the vagina. So normally placentas are on the side. They're straight up solid on the side. Okay. Now, just so you know, with positioning, anterior is towards you guys and posterior is towards me. So anterior is towards your belly button and posterior is towards your spine. So those are two other positions of the placenta, but again, they're kind of up here. When you're talking about your cervix, a complete placenta previa covers that cervix. If you have a placenta previa, you are having an automatic C-section. A partial placenta previa is exactly what it sounds like. Part of the cervical os, this is the cervical os or cervical opening, is covered by that placenta. Again, this is pretty much usually an automatic C-section. But some people will have a low lying. So a low lying placenta is sitting right next to the cervical os. And what it does is as the uterus, so the uterus starts out small, right? And it grows bigger and bigger as baby grows bigger and bigger. Everything starts out small and gets bigger. Okay. So if you have this very low lying placenta, but the uterus is going to get bigger, it's attached to the wall. It's not like it's not attached. So what happens is as that uterus wall stretches up, the placenta will move with it. So as it migrates away from the cervix, you potentially no longer have a low lying placenta. Very normal. If you have a low lying placenta, some people will have to have a C-section and some people can have a vaginal birth, but it's just dependent on a lot of different factors at the time that you deliver. Now, they said it was probably going to move away from my cervix by the time I reached 32 weeks. I am 24 weeks now, but I'm wondering if anal sex would be better for me. Now, I'm guessing she's worried about anal sex more from the idea of bleeding because of the placental position. I'm not sure. But here's what I'm going to say. Once you're off of pelvic rest, you should be able to have whatever kind of sex you want, anal, vaginal, oral, unless you've been told otherwise by your healthcare provider. This is not a question I can specifically answer for you because I am not familiar with your whole profile. But for anybody who's wondering this, there is no reason, generally speaking, for you not to be able to have vaginal or anal sex unless directed by your healthcare provider. I want to be clear, if you are told not to have sex, please make sure you ask if you are allowed to have an orgasm. Because many women are allowed to have orgasms, they're not allowed to have penetration. Now, when we're talking about sex, it is extremely important that you guys utilize very good common sense practices. For example, there are many people who go ahead and they'll have vaginal sex and then they will have anal sex. And sometimes people will go back to vaginal sex. Okay. So let's talk very realistically. I don't want any judgments here. You need to make sure that you don't do that if you are pregnant. One of our biggest risk factors for having a miscarriage or preterm birth is infection. A practice like that for a normal, healthy woman is fine. If that works for her and her partner, it's fine. Okay. But for a pregnant woman, you are considered immunocompromised, which means introducing any kind of bacteria like E. coli, which is common in stool and in the anus, could cause a serious infection. It could also lead to a urinary tract infection, which is also a common cause of preterm birth and miscarriage. So it's really important that you do practice good hygiene. I often suggest for men and women, if this is a concern, if you're having any kind of complications, potentially start your foreplay in the bathroom. Take a shower together, get cleaned up, make sure you guys are all ready to go and fresh. It's nice to be clean anyway. If that's not your normal practice, maybe you'd like to start making it your practice. And then just make sure toys are clean, hands are clean, you're using everything clean. You do not have to be a germaphobe, okay? But you do want to make sure that everything is clean. And it's very, very important. If you douche, that is using a kind of like a vinegar cleansing solution in the vagina to help keep yourself clean. It's actually not good for you. It's not good for your vaginal biome. It really messes up your normal flow. It can cause infection. And so you definitely don't want to do that as part of making sure you're clean during sex. Let me make sure I answered all of that question. Okay, yes, I did. So now I'm going to answer the question that I have in the chat. I'm 41 and I have high blood pressure and we are trying to get pregnant. Is it safe for me to have a healthy baby? So this is a complicated question. Generally speaking, it is safe for you to have a baby. Unfortunately, high blood pressure is on the rise, and this is extremely common. The biggest thing is that you need to make sure that you are managing your blood pressure well. And if you're already on blood pressure medications, that you're actually meeting with a maternal fetal medicine physician ahead of time to make sure those medications are safe for pregnancy. Okay. I have taken care of women in the past who had high blood pressure issues, and the only medications that they could take were contraindicated for pregnancy, and their babies did have birth defects. So you've got to understand that not every blood pressure medication is safe for pregnancy. However, there are many different versions of many different blood pressure medications that can be switched out. So a good example is the beta blockers. Beta blockers are fantastic. They are like amazing drugs. Beta blockers are actually used in psychiatry to help with anxiety. They're actually very commonly used for test taking anxiety and social anxiety. So they're really, really amazing. Okay. Now, most of the beta blockers are safe. Okay. In fact, as far as we know, they really are all safe. However, the preferred beta blocker for pregnancy is labetalol. Now, labetalol may not work for everybody, and it may be too strong. So it's one of those things that you definitely want to be talking to your healthcare provider to see if it's something that can be used. Now, so you guys know one of the things that I am doing right now. So she's saying she's on losartan. One of the things your healthcare providers can do for you guys is they can look up medications. There's many different like references that we can use. One of the best ones is by Thomas Hale. He's a pharmacist and he runs the infant risk line, and he's created this whole like risk profile for medications for both pregnancy and lactation. It's a great, great, fantastic resource. Pharmacists are also a great resource because they have a lot of specialized training in medication and like understanding the pharmacokinetics. Okay. Okay. So this is a great reason. I always read, guys. You should never ever assume that you know everything. In my opinion, in medicine, I should always make sure that what I am doing is checking myself. Okay. I feel very strongly about that. Because that's what I need to do to give accurate information. So it's Thomas Hale's I'm using Thomas Hale's book. He's got like an infant risk book that you can look at. So losartan is not considered safe unless the benefits outweigh the risk. Benefits outweigh the risks. So losartan has been known to have an increased risk of kidney birth defects. So this is exactly why, and I'm really grateful that you're on here asking this question. That's amazing that you're asking the question. Now, does this mean it is hopeless for you to have a baby? No. What it means is you need to ask your OBGYN to get you in with a maternal fetal medicine physician. Those are also called perinatologists. These are the doctors that take care of high risk pregnancies. Sorry, it's been a long day, guys, and apparently I'm having tongue twister. So, high risk pregnancies are going to be your pregnancy. High blood pressure is definitely considered high risk. And guess what? Just so you guys know, if you're over the age of 35, you're considered a geriatric pregnancy. So that's fun too. So a maternal fetal medicine physician can actually start to guide your blood pressure management ahead of time. And so they can look at what you've been on, what your current blood pressures look like, and try to get you switched off into something that's a safer profile for you during your pregnancy. Now, the other thing is a lot of fetal development, as you guys know, happens very early on. And then a lot of that organ development is finished up by mid pregnancy. And then a lot of it's just growing and developing. So, for example, if this has been a really good blood pressure medication for you, generally speaking, it might be something where they can switch you into something else to get you into like 22, 24 weeks of pregnancy and then get you back on it for the second half. So, there's all different ways to work around it. Do not stop your blood pressure medication. Let me make that clear. Because if your blood pressure goes super uncontrolled before they can switch you out, that can actually put delays on the whole process. Okay. It's just very important that you go ahead and get started in your case with some medication management counseling. And I think this is a really good example of why it's so important for people to start to ask these questions. But no, it doesn't mean you can't have a pregnancy. It just means it needs to be managed. And yes, MPG, yes, I agree with like everything that you just said right there. So yes, if you guys have any other questions, please feel free to put them into the chat. I'm going to go on to my next question. Um, so I hope that helped. Um, I have a high sex drive now, and that I'm 8 weeks pregnant. We have sex every 2 to 3 days. I don't have bleeding after sex. Is this too much? So, just so y'all know, if you guys are enjoying sex and you don't have any risk factors and nobody has told you otherwise, you can have sex as much as you want. For those of you who might be pregnant right now or about to get pregnant, do not feel pressure. If you're hearing some people say that they want to have sex all the time, some people have no interest in sex in the first trimester. They love it in the second. They have no interest in the third. It's just variable. I have some people that postpartum are just dying to have sex again. It's just very random. So please don't base your experience on anyone else's. Just understand that the biggest thing is to go with the guidelines of your healthcare provider. Now, that being said, she mentioned bleeding because we hear about bleeding after sex. Why does this happen? The hormones that are needed to maintain a healthy pregnancy tend to thin out the vaginal tissue and make it drier. So, this is one of the things that causes painful sex. And it can also cause you to have micro tears. And those micro tears can cause some bleeding or spotting, which is what you will notice after sex. And then remember, if you have a micro tear with some good orgasms and uterine contractions, you might see a little bit more spotting. Um, which leads to the last sex question, which is I have too much pain during sex. I can't enjoy sex. I feel pain in my bladder and please help. Okay. So I'm going to tell you pregnancy and postpartum sex can be challenging because sometimes you're in the mood, but it's not comfortable. So you might have a baby that's sitting the wrong way. You might have some ligament pain. Like I have a video on pelvic pain during pregnancy, which is a real thing. There's a lot of round ligament pain that can happen. So it's very, very challenging sometimes to enjoy sex. So, number one, lube. Okay, guys, like this is something that I cannot say how much I tell people that they need to do this. People try to like it's not cheap out, but they try not to use it because they don't want to get stuff on the sheets and they don't want to be sticky afterwards and all this other stuff. Guys, use lube. Put down a towel, bring some extra napkins to wipe yourself afterwards, but you got to use lube because it's going to make things so much easier, both while you're pregnant and postpartum. Okay. Just buy gallons of it because really, you want to be able to have good sex. And frankly, you may be on a little bit of a time limit. And I'll explain that in a minute. The second thing is warm up. Okay. So foreplay is very, very important. It's very, very important to get your body going. When you get aroused, you get a whole bunch of blood flow down to the vagina. Okay. When this happens, the tissue becomes like softer and more supple. And it moves easier when you're having sex. So if you were ever to, and I encourage women to know what their vaginas are like, if you were ever to take 2 clean fingers or 1 clean finger and stick it in your vagina when you are not aroused, and then maybe when you've been turned on, whether it's during masturbation or sex, before you were to do anything, to stick your finger in, try to remember the difference of the feeling. And it's going to be really different. Your vagina feels very different when you are turned on. We are meant to have sex when we are turned on. Okay. So this becomes essential. Now, let's just talk logistics. Let's say you have 3 small children and you've got like 20 minutes to do this thing, and you do want to have sex, but like you're trying to work it all out. Maybe you go in and get started while your partner finishes up with the kids or something like that. The other thing is, we live in a wonderful world of modern inventions, including toys. Now, I do not recommend anything inserted into the vagina while you're pregnant, not without a clear okay from your healthcare provider. Okay. So no toys inside the vagina. Why am I saying this? Because of infection only. If you are not being very careful with cleaning your toys, if they're going internally, then you could get an infection from some bacteria on the toy. However, feel free to use anything you want on the outside, specifically vibrators. Vibrators are amazing. You can get them at Walmart now. You can buy them on Amazon. They can get shipped to your house, and they are amazing for helping you have better sex. Okay, so this is something that I very much encourage. Okay, now the final thing is, she's talking about pain during sex. So sometimes what will happen is that we're having a good time and we've had an orgasm. And when you're pregnant or postpartum, again, those hormones, they're thinning out the tissue. You can be very uncomfortable. And all of a sudden, something changes from a good time to a not so good time. She mentions pain in the bladder. Maybe her bladder's getting full because pregnant women need to pee all the time. But whatever is starting to make it uncomfortable, now it's not something she's enjoying anymore. And this is why I encourage a lot of couples to have a very respectful kind of discussion about when somebody's starting to not enjoy themselves. And usually, what will happen is men are trying to be very respectful to their partners and make sure that they've had a good time first. So once you feel like you're ready, you guys have this kind of signal where you can say to them, like, hey, I'm in pain. It's okay. I've had a good time. If you can go ahead, without having to say, like, hey, hurry up, because that's really dismissive and that's not cool. So if you talk ahead of time about this and you kind of come up with a signal, it can be a really good way for you guys to have good like communication without one partner feeling dismissed. So that's that. For any of you guys who are joining me, I'm Dr. Samantha, the maternity mentor. Please feel free to put your questions into the chat. And if you stay until the end, I will give you a sneak peek at tomorrow's video. So, hi there, Obapa. Is it safe to take Tylenol for mild cramping? Okay, so yes, question mark. Why the question mark? So, Tylenol is safe for pregnancy. It is safe for postpartum. The reason why I'm saying question mark is if you are cramping because you are pregnant, you need to go get to the hospital or call your healthcare provider to get checked out. Cramping is not something you ignore because you could be having uterine contractions, okay? Now, the other thing you guys should know about Tylenol. Tylenol used to be one of those things that we thought was just totally safe. It's in the drugstore. You just picked up off the counter, and people were just swallowing Tylenol like it was no tomorrow. Tylenol is also called acetaminophen or paracetamol. I think is the European name, paracetamol or something like paracetamol or something. So what we now know is that if you take too much Tylenol within a 24-hour period, you can go into complete liver failure. Complete, I need to go to the ICU and be like in an ICU on a ventilator because I've almost died from liver failure. This sounds exaggerative. Please feel free to Google this. I don't encourage Google much, but this is one of those things. It's a very serious thing. And once this was starting to realize that it was happening, Tylenol had to change all of its labeling on all of its products. You now see these big warnings about this. So you must make sure you are taking only the amount that the Tylenol bottle says. Now, I think it's 4,000 milligrams in a 24-hour period for an adult, right? So 4,000 milligrams, and it's every 6 hours. So that's 4 times a day, up to 1,000 milligrams, okay? 500 milligram extra strength Tylenol. In the hospital, if we have given you 3 doses, right? And we're about to give you that 4th dose and it's too early, if it's 10 minutes early, we cannot give it to you. That is how serious this is. So please understand, when I say you can take only whatever the bottle says in a 24-hour period, you do not get to take it 20 minutes early. You don't get to take it a minute early. You should be telling yourself, I need to wait until after, not before. Now, as far as anything else, though, mild Tylenol for cramps is usually very effective. For those of you guys who are wondering, you usually can't use ibuprofen and like ibuprofen, Aleve, Advil, Motrin. You can't use those products during pregnancy or postpartum for blood pressure issues and bleeding, okay? Because they all thin out the blood so you can bleed, and they can also contribute to blood pressure issues. So we usually avoid those. Hi, Tess. How long does it take for breast milk production to go away once fully weaned? Unfortunately, it is hard to say. If you have used all of the tricks for more than a couple weeks, you need to have your prolactin level checked. So prolactin is the hormone that tells us how much milk to make, like the milk quantity hormone, okay? And when we stimulate breast milk during the times that prolactin is high, it encourages more milk production. There are some times where prolactin levels can be high for other reasons. And then what happens is an individual who is not breastfeeding can actually produce breast milk. This includes men. So men can produce breast milk when they don't want to. And this is because they have a high prolactin level. So they can be caused by a variety of things, one of which is stress. So stress is actually a very common cause of having too much prolactin, and that can increase breast milk production. And if you're trying to wean and you're already producing breast milk, it can make the process hard. So it is one of those things that if you are still producing, you want to have your prolactin level checked. Please check out the videos with the herbs and stuff. If you're mostly weaned, guys, and you have a problem like this, what you really want to do is you want to go hardcore towards the medication end of it. Okay. You need to get your healthcare provider's permission, but you want to go hardcore on like Sudafed during the day, Benadryl at night, peppermint tea. Peppermints, believe it or not, Altoids actually will help. If you have allergies and you can use allergy eye drops, go for that. You want to use, oh my gosh, I lost it. Oh, peppermint oil deodorant with real peppermint oil. Peppermint dries out milk. So you want to like try to do all of that stuff to help. Make sure you're not taking long hot showers. Try to keep all the warm water on the back. Try not to stimulate. So when you're having sex, wear a bra. You know, just you wear a bra at all times. You just want to avoid as much stimulation as possible. Okay. And then see if that helps. But you may need to have your prolactin level checked. Okay. So I had a question on my dental video, which I think dental work is really important. What can happen if I get pregnant at 38, having previously done dental implants at 36? Is there a risk of infection? Shall I pull them off? There is no evidence that I have ever seen that you need to pull off dental implants before you get pregnant. But I think that, so I would say no unless somebody's telling you to do that. But what I will tell you is this highlights something very important. We often we misjudge how important dental work is during pregnancy. So I don't know if you guys have ever heard about somebody who has to take antibiotics before a dental procedure, just in general. Why does that happen? That's because the blood vessels here connect basically directly to your heart, like directly. It's so fast for an infection in your mouth to go straight to the heart. And what it used to be was that when people had especially valve issues like mitral valve prolapse, they found that they were at a higher risk for endocarditis, which is a type of like infection of the heart, and pericarditis and other things when they had dental work. So then what was happening was people were being told you need to take antibiotics before you show up to have your cleaning or before you show up to have your filling or whatever it was. So how does this relate to pregnancy? Remember what I've said, any infections increases your risk for miscarriage, preterm birth, and stillbirth, okay? We want to avoid infection. You are immunocompromised during pregnancy. If you weren't immunocompromised, your immune system would go full-fledged attack dog against the baby because your baby is a foreign body. It is not something that belongs there when you think about your immune system. So your immune system naturally, in order to protect the pregnancy, is muted. And so as a result, you're higher likelihood to get an infection. So we want to make sure your dental care is spot on. For anybody who's looking to get pregnant, like the viewer earlier, you want to get your dental care done now. If you are not pregnant, if you're in between pregnancies, do it all. Deep cleanings, fillings, all of it. Get it all done in between. It's one of the most essential things for your health and the health of your pregnancy you can do. Once you are in a pregnancy, if you need a cleaning, get your cleaning done. If you need a filling, get your filling done. Now, would you want to have your wisdom teeth taken out if it wasn't an emergency? No, you're not going to do that. In my cosmetic procedures, I list some of the dental cosmetic procedures. You would want to be thinking about those. But for actual dental work, you want to get it done. It's actually been proven to be really good for your health and the health of your pregnancy. For those of you who are joining me, please feel free to put your questions into the chat, and I promise I'm going to give you a sneak peek at tomorrow's video. So I had a couple questions on a video that I put out called Superfoods, like for pregnancy. Our bodies, our mind bodies are connected, and nutrition is extremely important to your health. And of course, is extremely important to the health of your pregnancy. So it's very important that we are taking that into account when we're having a healthy pregnancy. So the first question was, thank you so much. Can you tell me about Axic folic? When should I stop taking it during pregnancy? So unfortunately, I'm going to say that I don't know because specifically AXIT folic is not something that I use here. It's not something I'm familiar with. However, if this is folic acid, if this is regular folic acid, you do not want to stop taking it. Folic acid is one of the most essential vitamins that you can take during a pregnancy because it helps prevent neural tube defects. So neural tube defects defects in the brain and the spinal column that can actually lead to miscarriage if the baby has a birth defect that's not compatible with life. So this is also one of the common reasons when you have folic acid deficiency, why a baby might have spinal bifida. That's where part of the spinal cord, usually down towards the bottom, like the sacrum where your butt is, will be open to air. And this can lead to paralysis and other things for the baby. So this is why we need folic acid so much. I will tell you, I recommend women in my practice from age 15 to 48 to take a prenatal vitamin. Now, a lot of you would say, but a 15-year-old isn't trying to get pregnant. A 48-year-old might be in menopause. Like, why the age range? Prenatal vitamins do not make you get pregnant. This is not something that you're going to automatically get pregnant on. But if you think about it, a prenatal vitamin is designed to be the ideal vitamin for a woman to take during her fertile part of her life. Okay. And guess what? From 15 to 48 is that time period. So even if you're not trying to get pregnant, prenatal vitamins are the perfect vitamin for you. And that's why you'll hear women say it helps with my skin, it helps with my hair, it helps with my nails, because that's what you're supposed to be taking right now. So I would encourage everybody to take that. And that in particular has more folic acid than other vitamins because we know that it's needed for a healthy pregnancy. Now, the other thing was it said fat-free milk. What about whole milk? So this is like a fantastic question. So let me explain a little bit. So this video is kind of based, and I would encourage you guys to check out the superfoods video. It's really good. It's based off of kind of the common middle of the road advice on nutrition during pregnancy. Okay. The reason why I suspect this viewer said that is because I also have a video on keto, and I'm a big proponent of keto. I love keto. It's important, just like I give you guys videos on formula feeding and breastfeeding, it's important for you guys to hear different perspectives on stuff. And the superfoods video is not bad. But when it comes to milk, yep, this is probably like a kind of gray area, and it depends on your health profile. So most people hear that they should be drinking fat-free milk, and there's a variety of reasons why you wouldn't want the fat part of it. However, when you're talking about keto, fat-free milk is not what you guys want to have. And I will tell you, if you're diabetic, you should not be drinking fat-free milk at all. That you should just either not drink milk or drink whole fat milk. Why? Fat-free milk is basically sugar water. The healthiest part of milk is the animal fat. Okay. So if you've ever seen a glass of fat free milk and a glass of whole milk next to each other, the fat free milk is like gray and thin, and the whole milk is like white and thicker. Now, I do know that there's some chemical processes. We're not getting into any of that, but you can tell there's a difference in consistency and color. And this is because all the good stuff was taken out of the fat free milk. Okay. Now, why would you drink fat-free milk then? You might be drinking it if you need a low-fat diet because maybe your whatchamacallit, you're on a calorie restricted diet. Maybe your cholesterol isn't great. I mean, there's like a whole bunch of reasons why you might need that. But what I will tell you is that if I was to lean in one way, I'd be leaning towards the whole fat milk. Why HbA1c isn't really reliable in gestational diabetes workup? Ah, okay, good question. HbA1c is a measure of long-term sugar. So it's not looking at the last couple weeks, it's looking at the last couple months. So it's almost like an average. It's not short term. And so when you're talking about gestational diabetes is not regular diabetes. It's almost like this autoimmune-ish type of response that happens when you become very insulin resistant because of the pregnancy. Your body is just changing so rapidly and your system can't keep up with it, right? So the thing is that you could develop gestational diabetes in the matter of 2 weeks. And I've seen it happen. I've seen women go in for their glucose test, the oral glucose test where they drink the sugar water and they pass it, and 2 weeks later they fail it miserably and they're diagnosed with diabetes. Pregnancy is too quick to get that data. This is actually a great question because leads into one of the other questions a lot of people say is they will ask, well, why can't I be put on metformin or glucophage or something else, a pill basically that they've heard other people take for diabetes? The reason why is we don't have enough time. There is not enough time in pregnancy to get those things to work. They take a while to get started. This is the other reason why diet control is not really that effective, and a lot of people go straight to insulin. I will tell you as a healthcare provider, if I got diabetes right now, I would beg them to put me on insulin. Beg them. I wouldn't want to do diet control. I would try to control my diet, absolutely. So please look at the keto diet. That's low carb. It's really good for diabetes. I would absolutely follow every letter of the law that they gave me diet wise, but I would beg them not to let me go a week, 2 weeks to see if I could figure it out myself. I'd want to be on insulin straight away. When your sugar is out of control during pregnancy, it can cause an immense amount of complications with the baby, very specifically the baby. These babies come out and they're huge. And we think that that makes the kid okay because we're so used to like a preemie that's sick being small. But gestational diabetes babies are huge and it's not in a good way. Their body has been pumped full of sugar. Their insulin does not work. Those babies, their insulin does not work. They come out, they cannot regulate their sugar and they crash hard. Remember, your brain needs sugar to work. So if you can't function, if you can't process sugar correctly because that whole balance is messed up, that's it. You have a floppy baby who can't breathe, who can't regulate their temperature, and we're rushing them to a neonatal intensive care unit to give them IV sugar because that's the first thing we can do to try to stabilize them. The next thing is these babies are giant, which means it puts you at risk for having a C section, which is a much riskier delivery for you. So we want to keep babies' weight down. And I will tell you that sometimes, even if a woman is eating the most calorie restricted diet with the least amount of sugar, doing everything right, even on insulin, their babies will still be giant. Sometimes we cannot keep up with it. A good maternal fetal medicine physician will be checking your your blood sugar log. They should be having you do a blood sugar log and possibly adjusting your insulin every week. So, really, once we're inside a pregnancy, to go back to your question, Richard, that HbA1c, it's too long of a period. That doesn't give us an accurate description of what is going on now. And the here and now is the most important. Because again, if your sugars for the last week have been 250, but before that they were all perfect, your HbA1c in general might be low. It might actually be really low, and that's not reflective of what's going on now. So that's why. But HbA1c is really good for other reasons, but just not that one. Um, we had a question on water for formula, which is pretty easy. Can I boil the distilled water and then cool it and then add formula? And should I do this for each feeding? So I have a video if you guys are formula feeders, which I am a lactation consultant. I've been a lactation consultant for 12 years. Totally believe in breastfeeding, totally believe in formula feeding. I think they're both great. I think there's benefits to both. I think there's risks to both. So for anybody who's formula feeding, spot on. I'm totally there with you. What is my biggest thing? You need to make sure that you're preparing the formula properly. And if you're a breastfeeder who's doing bottles, you also need to make sure you're doing all of that right. And I actually have videos on like how to clean your bottles and stuff because a lot of people don't actually know quite how to do that. And it's actually really important that you do that properly and that you're looking at stuff. So I have some videos on that. So as far as boiling water, depending on what type of water you're using, it is necessary to boil. Distilled water isn't one of them. So distilled water isn't one that you have to boil. You're not going to hurt anything if you boil it, but save yourself the time. If you're buying distilled water, it's just not necessary. So that's a good one. And for those of you guys who are formula feeding, please feel free to check that out. I'm down to my last two questions, unless something else comes into the chat. This next question was on my yeast infection video. So it says, I love tea tree. Gosh, I love tea tree oil also. I think apple cider vinegar. So I think she was referring to two things she's tried. I had an HSG test this month. I don't think the place was very sterile. I am trying desperately to get pregnant. I'm experiencing some itchy, white, clumpy discharge the last few days. Could this be an early sign of pregnancy? I'm still a week until I have my cycle, and I feel like it's a yeast infection. It's very uncomfortable down there. So this is like extremely, extremely important. Okay. So, yeast infections are a very common cause of miscarriage and preterm birth. I think that we are like really not paying attention to it as much as we should. I think UTIs, urinary tract infections, are the big spotlight ones, but yeast infections are a very big deal. So you have a microbiome in your vagina. You have all these different normal bacteria and funguses and stuff, and that's supposed to be there. And one of the things that you can do to help maintain that is you can actually take probiotics, which while they are part of your intestinal flora, if your whole body's working well with flora, your vaginal flora will be good as well. Okay. So this is something that I think is very important. But if you have a yeast infection, it's also very important that you treat it well and you don't necessarily want to reach all the time for homeopathic. So I'm going to assume the apple cider vinegar and the tea tree oil were two homeopathic remedies that she had tried. So let me address both. The first one is apple cider vinegar. So apple cider vinegar is not indicated for yeast infections. We get a whole bunch of stuff about um, about this, right? It's talked about as being like a homeopathic treatment and different things. However, this is not something that's evidence based. They've studied it, they've looked at it. You'll hear people say, "Oh, I add it to like my bath and I do this." Some people drink it. Drinking it is not going to help a yeast infection. It helps for other things, but it's not going to help with a yeast infection. So the bottom line is it is not going to work for this, in my opinion. Okay. There's no evidence to say it was. And definitely do not use any kind of vinegar in the vagina. It's going to mess up the whole biome. Okay. So that's the first one. Tea tree oil suppositories have been shown to be potentially helpful for treating yeast infections. Okay. Now, would I recommend a tea tree oil suppository when you are pregnant? Absolutely not. Absolutely not. There's no way, shape, or form. Why? Because every single vitamin that is out there on the shelves right now in the United States, including vitamin D for your baby, including probiotics for your baby, like everything. So, everything for your kids and everything for you. It is not FDA regulated. It is not like approved. It's not monitored, nothing like that. So, because it is not monitored, there is no way I would put a tea tree oil suppository in my vagina if I was pregnant. There was nothing to say what's actually in that suppository. So, if you are pregnant, you need to go to your healthcare provider to have them guide your yeast infection treatment. Because the other thing is, they may not want you to be sticking random suppositories into your vagina. If you're pre-conception like this person, you could try it, but there is now a growing issue with yeast resistance. So we have bacterial resistance, we have viral resistance, we have yeast resistance. So unfortunately, nowadays, sometimes you need stronger and stronger meds to take care of a yeast infection. If you truly think it's a yeast infection, a lot of people can just call their healthcare provider and get diflucan, which is a really good treatment for for yeast infections, like an oral diflucan, and that's really good, especially when you're not pregnant. So that's a good one. Is seed cycling helpful? So seed cycling is this method for like regulating your hormones, and it's complicated. Usually you want to have like a homeopath help you with seed cycling. What it can do, and maybe I'll do a video on this because it's a little bit more um it's kind of an alternative way for regulating female hormones. The thing is that I do believe it can be helpful. I believe it is way more complicated than reading some of the articles that you see, because there's so many foods and so many hidden ingredients that affect our hormones. People don't realize how much is in our environment that affects our hormones. And so it's really important to make sure that you're taking that into account when you're trying to balance out how you're using the seeds. The other thing is, I would definitely never do anything with this if you were pregnant or breastfeeding, because it's working with your female hormones. Okay. So you mess around with your hormones, you're going to mess around with those two things. And it requires the long haul steady patience. Seed cycle is not going to work just right like that. It's something that you need a long time with. So the short answer is, do I think it can be helpful? Have I seen it be helpful? Yes. Do I think it's easy to do? No. And do I think it can be like more trouble than it's worth? Yes. Okay. How can I help my newborn baby get rid of rash? She has some rash on her shoulders and legs. So that's a great question. I have a video on that. Not that I'm not going to answer, but just so you guys know, I have a video. At least I'm pretty sure I have a video. So one of the biggest things for anybody, right? If you have any dark folds that are warm and moist on your body, you can get bacterial overgrowth and you can get yeast and fungus overgrowth. Okay. This is very common for babies. Unfortunately, babies in that diaper area, they get really moist and they get really dark and that it gets this rash, right? It's very important if the rash is just not going away, do not use homeopathic remedies without talking to your pediatrician first. There's a lot of different remedies out there that don't work and can actually be more harmful than good. But you want to make sure you get your pediatrician to kind of look at it. The nice thing is, in today's day and age of telehealth, a lot of times you can go on a telehealth appointment versus bringing your baby all the way to the pediatrician, and you can cover your baby's private area so that it's not seen on camera, but you can hold the camera to show like the folds so that they can look at the rash and actually help you identify it without ever going in. So believe it or not, that's something that you can do. Depending on the rash, you might need some like stronger prescription strength cream. But honestly, what is the best thing you can do? Let your baby go without a diaper. So I'm going to elaborate more on that in about 5 minutes, Steve. Okay, so give me 5 minutes. What does apple cider vinegar help with? So it helps with a lot of different things. For starters, it helps with digestion. It also can help with insulin sensitivity. So a lot of people with diabetes will actually use it. Believe it or not, even though it seems like it's kind of acidic, it can actually help with heartburn and it can help to like decrease your bacterial growth inside your gut. Okay. Now, there's a multitude of other uses for it. Like, there's so many, but for some reason, it's not always tolerated by everybody. So that's one of the things. My last question, I'm going to go back to you, Steve, was I had a question. Is it okay to take Serlin 100 milligrams during pregnancy? This is on my depression video. So I'm not familiar with Serlin, but I believe this year was talking about sertraline, which is Zoloft. So sertraline is safe for use during pregnancy. It's one of the most common medications that we will prescribe during pregnancy because it's given to like every pregnant woman and every breastfeeding woman. It's very, very safe and effective. It is used for depression, for anxiety, for panic disorder, for OCD. It's really important, guys, that if you feel like you're struggling with your mood, to get evaluated by a healthcare provider. There's many healthcare providers like myself who will prescribe prescription medications for you during your pregnancy, but we can also just help guide you and try to get you through until you're postpartum and then reevaluate. But sertraline is effective. So back to Steve. Steve's my final call. What about shoulder rash and back of the neck? So that is usually all caused by being hot and sweaty. However, I will tell you that that might be also eczema. So eczema is like an autoimmune type of rash that can actually show up if a baby is allergic to something. So some babies who are breastfed and actually babies who are formula fed can have different types of allergies, and those allergies may manifest as rashes. But again, if the baby's really hot and sweaty, then if you're having a lot of like sweat on the back, that can cause it. So what is my number one recommendation for diaper rash and actually for that shoulder rash? And what ties into video? Tomorrow's video is on all the benefits and how to do tummy time and when should you start doing it. So tummy time is one of the most important things you can do for your baby. And it's really important that you know how to do it, when to do it, and all the steps to it. I will tell you without spoiling anything for tomorrow's video, tummy time is time spent on the tummy. And when you do that, Saif, to help with the rash, you can take off your baby's diaper. So you can go ahead and make sure the baby's on a towel so that you don't mess up your floor. And you guys can actually, if the baby pees or poops is no big deal. But having the baby's bottom and shoulders, so if the baby's on the tummy, the shoulders will be open. Having the baby open to air, letting air just dry out the skin and just rush over the baby is actually really good. And babies, we often treat them like they're delicate. Newborn babies, full-term babies, they can tolerate being unwrapped. 2-month-old, 3-month-olds can definitely tolerate being unwrapped. They do not need to be bundled up all the time. If your house is on the cold side, warm it up before you put your baby tummy time. And if your house is, too warm, well, then the baby's going to be just fine. Maybe that's part of the reason why they're getting a diaper rash. But definitely, definitely, I would do tummy time with no diaper on, and that should help. And I would also, in your case, that you possibly snap a pic to send to the pediatrician, because with its shoulder and neck, it could also be eczema. Although it sounds like it's probably just the baby sweats. So I am done. My name is Dr. Samantha. Hi, I'm the maternity mentor. I'm here every Monday at 9 p.m. Eastern Standard Time to answer your questions live. I answer questions that you put onto Facebook, Instagram, Twitter. Please check us out over there. I answer questions that you guys have put onto the videos. If you guys give me suggestions for videos, I try to, get them out into video content for you. Please remember to like and subscribe to the channel. Subscribing really, really helps me out as a content creator. Please do that. Please subscribe. It is so, so important. And hit the notification bell so you can get notified of our latest videos, including the video tomorrow on tummy time. Remember to share the channel with your friends and family. Remember, we have now been approved to be a part of the YouTube Health platform. This means I have been vetted as a legitimate healthcare provider. The channel content has been reviewed to be legitimate in nature. So you can trust the content of content providers who are part of YouTube Health as verified healthcare providers who are providing good information for you guys. I really hope you guys are all well. I will be back next Monday for another live Q&A session. Until then, guys, I really appreciate all of your support. My name is Dr. Samantha. I'm the maternity mentor. Bye for now.